You're suffering from chronic low back pain and you don't know how to finally strengthen your core, back, glutes safely and effectively, then this video is just for you. Hi, my name is Annie. Welcome back to my channel, Annie Pilates Physical Therapist. If you're new to my channel is about Pilates, yoga, physical therapy, health and wellness, and in this video, I'll be demonstrating a lovely Pilates, yoga, physical therapy with proper breath work to finally engage a weak back, core, and glutes safely and effectively. So get your mat ready and join me.
I don't wanna stay here, no. Ain't gonna keep it low. Now, if you wanna go, let's go. Let's wrap it up and hit the road. I just gotta know some.
Okay, my friends, before we start, let's discuss about chronic back pain. When you're having chronic back pain, you have this never-ending cycle of back pain, stiffness, tightness, and muscle spasm. The best way to get out of this loop is to slowly move your body. Resting in bed for prolonged periods of time will make you weaker, and that's the worst thing you can do if you have back pain. Sitting a lot will cause pain. Any prolonged position, if you want to exert effort and you want to get stronger faster, you don't want to just walk outside and start walking, because sometimes you just have to slowly build up that core. And walking is one of the best exercise for back pain, but if you're already in the muscle imbalance loop, it could create a lot of spasms and exacerbation if you walk too much too soon. So my recommendation is to start activating your core first. Proper breath work, core engagement, especially if you have one-sided low back pain. You want to lift that area, balance your pelvis alignment, fix your rib flare that happens when you're breathing shallow. You want to inhale, exhale properly, and proper alignment of your body. Once you engage this properly, then you can slowly stretch. But of course, you want to stabilize first. Walk, move with proper blood flow of movement patterns, and then stretch. Because if you overstretch as well, you can pull certain areas that will cause more pain, that we call it angrier, crankier one-side back pain. So it should be a proper balance that's enough to move your body, and then every single day you progress. I would rather you start snacking your workout, which means you divide your workouts from 3 times a day, like a breakfast, lunch, and dinner. Even just 5 minutes for absolute beginners, better than nothing, than doing everything in one day, 1 in the morning or 1 in the evening for 15 minutes. And then once you can tolerate 5 minutes 3 times a day, spread it out. Then you can add extra 5 more minutes every single day, as much as you can tolerate. If there's more pain, stop. You want to make sure you stop before you increase more pain. And sometimes I have patients, they complain more after, because they didn't listen to their body. They push themselves a little bit more, and then it will cause more pain. And guess what? When you have more pain, you get weaker. So you ended up in that never-ending cycle of loophole. So that's why, let's begin this program. We're going to start with breath work, and we're going to lie on your back. Lying on your back is one of the safest, and some patients would recommend lying on their stomach if they're extension prone, but it's best to have pillows on your abdomen so it's not pressing on your lumbar spine. If you have a lot of inflammation on your spine, it could be from your disc, so soft tissue structures, or back spasms. You could strain your back because of lifting something too heavy, and you exacerbated your back pain. And if you've lifted something too heavy with poor body mechanics, my recommendation is for you to wear back brace. If you can't contain your proper posture and lifting, and it's too heavy, if you have weak upper body, weak lower body, then I recommend you getting a back brace. And this brace that I would recommend is Stott back brace. Stott back brace is one of the best back brace out there, wherein it could support you when you go to the gym, when you lift heavy and you want to start lifting weights. If you feel like you don't have back pain, but you want to prevent back injury, wearing a back brace doing deadlifts and squats will prevent back pain exacerbation. You have to move a lot of furniture if you're moving to a new home, or you're moving around your furniture because you're cleaning. Wearing a back brace, if you have chronic back pain, wear a back brace to support your back. Let me show you the Stott back brace. So this is Stott back brace. How to wear it? You're going to position the back brace just above your hips. Position the inner belt. Make sure you place it comfortably, not too tight so it won't restrict your circulation. and then you wear it up to 3 hours only, not more than that. Because if you do it too much, then you make your core weak. That's why you want to do some core engagement before wearing a back brace. This is recommended if you're doing any high impact activities to prevent back pain exacerbation. And it's really proven scientifically research with back brace. It helps patients with chronic back pain to get out of that chronic loop, because every time you feel stronger, that's when you do extracurricular activities such as sports, playing golf, even just walking further. Having a back brace will help you support the unstable structures of your spine. Together, don't forget doing your Pilates, yoga, physical therapy, because if you just do back brace and you don't do anything, it won't help to strengthen your core. This is just for prevention, at the same time for part of healing process. So let me show you how to wear this back brace. There's also a container included for it, so it's perfect if you're going to the gym and you're going to do some lower body days, or even chest press, military press. If you're lifting heavy, then having a back brace will support your back. And the good thing about this back brace, if you need to drive far, there's a lumbar support. And if your job requires you to sit a lot, then having this triangle part where you're having the pain will be enough for you to remind yourself to sit up straight, to engage your core. So this should be comfortable in the center of your lumbar spine with the triangle. This is attachable where you need the support, where you feel much better support when you're driving, and you need that back support if you need to lift something very heavy. Wrap it around and that's it. You have this back brace, and you can tighten it if you feel like it's not supportive enough, as long as it's not constricting your blood flow. Place it in front of you. So there's two ways of doing it. So first, the inner side, and then you go over from the left to right, and then right to left. And that gives a nice back support if you're going to do something heavy lifting. So if I have kettlebell workouts and you have some aches and pain and you don't want to have back pain, so doing deadlifts with the support of the back brace, squeeze your core in still. Try to engage your core as you do deadlifts. I'll show you when I go to the gym later wearing the back brace if I'm going heavier than my body weight on my deadlifts. And it's good to have a back brace. So if you notice, most people who are going heavier than their body weight and they feel not secured with their core strength, they wear back support. And this is good for gym workout when you need to lift heavy, and when you need to do moving around your furniture in your home, you need to drive far. Because when you're sitting a lot, it's 154% pressure in your spine. So this relieves pressure. So you want to make sure it's not more than 3 hours. And you want to make sure you do your core workout. And this is the program I'm going to start today. We're going to do some simple core workout, safe for back pain, safe for those with weak core, weak back, and weak glutes. So let's get ready with our program now. You don't want to wear the back brace while exercising your core, because that's different. You want to have space when you work out. This is only when you lift heavy and you need to bend forward, so without straining your back. Okay, my friends, let's start engaging your core safely and effectively with proper breathwork, core engagement, and includes activating Pilates, yoga, and physical therapy if you have back pain. Hold on behind your thighs, chin tuck, slowly roll down, one vertebrae at a time, and breathe out. Okay, my friends, let's start with proper breathwork. So it's important to slowly expand your rib cage as you inhale. Belly out, keeping your back in neutral position. One hand at the small of your back. So you want to make sure you can slide your hand at the small of your back as you inhale. And I'm gonna make my belly rise. And then as I exhale, squeeze my core in without pressing my back, keeping that gentle curvature of my low back, my lumbar spine. We'll do it 3 deep breaths in this position with your knees bent. Inhale, belly rise. Exhale, breathe out. Inhale. Exhale. Last deep breath in. Inhale. Exhale. Now slowly let go of your hands. Now I want you to press your knees tight together. Hands up in the air. Press your hands and press your knees as tight together. Belly rise. Inhale. As you exhale, slowly open your knees out and open your arms out as much as you can without increasing pain. You're going to feel the gentle stretch in your hip groin area, and then breathe out. Check your lumbar spine again without pressing your back if you want. Breathe in. As you slowly lift your knees back to the center, belly rise. Exhale, breathe out. Then open your knees out. Feet together, relax your knees down to the mat as much as you can. And squeeze your core in. Navel to your spine, breathe out. Inhale, knees together again. Squeeze as much as you can, hands together if you like, belly rise. As you breathe in and then breathe out, open your arms out to the side, open your knees out as well. And relax. Slow and steady. Slow and steady because you don't want to exacerbate the back pain. Inhale, knees together, hands together. And back pain exacerbation happens once in a few times a year, sometimes with chronic back pain, which means sometimes you're feeling good and there are times you can't move, and that's when you start moving your body safely. Squeeze your core in. As you open again, 2 more. Breathe in, belly rise, hands together, and then exhale, breathe out. Last one. Inhale, belly rise, breathe out. Well done. Now we're going to do some gentle marching to activate your very weak hip flexors, which are the prime mover of the hips. You can place one hand on your abdomen, again one hand at the small of the back. As you inhale, lift one knee to 90 degrees as much as you can, 90 degrees, without pressing your back at the small of your hand, belly rise. And then exhale, slow and steady, lower your right foot down and squeeze your core in and breathe out. And then switch to the left side, breathe in, breathe out. 4 more each leg. Inhale, exhale, breathe in, 90-degree bend, keeping your knee bent to 90, not too high like this or not too low. Keep it level. Exhale down. 3 more. Breathe in, breathe out. Left side. Inhale, exhale. 2 more to go. Inhale, exhale. Last one, my friends. Breathe in, breathe out. Last one, your left. Inhale and exhale. After doing that gentle marching, now we're going to do some gentle tilt. You can let go of the small of your hand up to your back. Place your hands on your pelvis. You can feel that if you place a cup of coffee, you want to press your back this time. Spill the coffee towards your chest as you inhale. And then exhale, spill it towards your knees. So you're going to arch your back. So you're going to feel a gentle massage on your back. If you sharp pain, stop. It means you're not ready. As I said, slowly progress. Inhale, squeeze, belly rise. And then squeeze your upper back and the low back area towards the mat as you spill the coffee towards your chest. And then exhale, spill it towards your knees. Again, inhale, exhale. Slow and steady with your breathing. Inhale, exhale. Last one. And exhale. The next one, we're going to do some hip fallout. And we're going to slowly lower one hip at a time to the side, keeping your knees bent without twisting your spine, keeping your core engaged. So example, I'm going to lower my right knee to the side. I'm keeping my left foot really planted down, my knees pointing up to the ceiling on the left, without following the right knee. As I lower my right knee down, I'm opening my right hip groin. As I breathe in, belly rise, exhale, back center. Squeeze my core in as I lift my knee back to the starting position and breathe out. And then to alternate to the other side, inhale, belly rise. And then exhale, back center. You're gonna feel some hip groin stretch, alternating right and left. And this is a great workout also before you lift weights if you're in the gym, because it's really lubricating your hip joint safely. Inhale, especially if you're gonna do squats today or deadlift. And if you feel like your back is not stable, but you want to lift weights, so you wear that back brace I recommended earlier. Inhale. Start back brace. 3 more. Inhale. Exhale. Feels so good in your hips, slowly warming it up. My recommendation is also go to a sauna, warm up your spine, your soft tissues. Sauna helps growth stimulation, so you help recovery when you're sore from a workout and help heal inflammation. 10-15 minutes in the sauna. If you're absolute beginners, my recommendation is just 5 minutes. And when you make sure you see your doctor first if you have a clearance, if you have any heart condition, and if you're pregnant. Inhale, exhale, center. Now, after we stabilize everything, now it's okay to stretch. Now that you engage your core, now we can slowly see the limits on how much you can stretch your hips. If you don't stretch your hips, that's when you can pull your spine. That's when you're having more back pain exacerbation. So let's start with figure 4. I'm placing my ankle on the opposite leg of my thigh just to do a figure 4 stretch. I'm not advancing by pulling my knees to my chest yet because that's extreme. If you're having a lot of back pain issue right now, it's just press your knee out to the side. You're going to feel that hip opening. Inhale, belly rise. Exhale, squeeze your core in as you gently just pull the right knee towards your chest, just inward. And you're going to feel that hip going release and your right glutes, and breathe out. Again, press your knee out, belly rise, exhale, pull it in. Belly rise, push your knee out, and then in. Last one, belly rise, and then in. Now let's switch to the other side. With your left ankle over your thigh, press your knee out, and then in. Press your knee out, inhale, and then in. Feels so good on your hips and your hip back. Inhale, press your knee out as you breathe in, and exhale in. Last one, inhale, and exhale. The last stretch is hamstring, active hamstring stretch. So that's different. We're not yanking your hamstrings. So you're gonna hug one knee to your chest a little bit, interlock your fingers behind your hamstrings, and slowly extend your right leg as much as you can. If you're a little bit buckled, that's fine. As long as there's no pain, just a gentle stretch with your toes pointing to the heavens, and then dorsiflex. Pull your toes towards you as you slowly bend your knee with some sciatic nerve flossing. You're flossing your sciatic nerve, and breathe out, keeping that toes pointing towards you, and then place your toes pointing down to the floor. Again, as you extend your leg, toes pointing to the heavens. As you breathe in, breathe out, dorsiflex, which means pull your toes towards you as you slowly bend your knee. You don't want to stay too long with the knee lock. And breathe out. And then as you reach your knee fully bent, that's when you plantar flex, toes pointing away from you. And then you go back again to the beginning as you slowly extend your leg, toes pointing to the heavens. Inhale, Dorsiflex as you bend. 2 more. Inhale, exhale. Last one. Breathe in and breathe out. Feels so good on your knee joint as well. Switch to the left side. Interlock your fingers. Place it behind your thighs. As you inhale, belly rise, toes pointing to the heavens. Dorsiflex prior to bending your knee. Exhale. Inhale. Exhale. Tippy toes and lift. Inhale. Dorsiflex and breathe out. 2 more, my friends. Feels so good. Last one, my friends. Inhale. Exhale down. And that's it. I'm hoping you enjoyed this gentle Pilates yoga physical therapy. If you're having back pain exacerbation right now and you need to start moving and not get deconditioned, you don't want to get weaker on your core, you want to keep moving your body but safely and effectively, because gentle movement creates better recovery. If you don't move, you stay in bed all day, just take your pain medication, guess what? You get weak. 1 day in bed, you get 7 days of weakness. And you don't want that. You want to keep moving, get out of that muscle spasm, pain, stiffness cycle loop. If you love this video, want to learn more about Pilates, yoga, and physical therapy, health and wellness, please subscribe to my channel, ring the bell so you won't miss anything, like and share this video. Every like you're giving to my channel, you are supporting me. And if you want to join my back masterclass and be part of my early bird waitlist, click the link on the description below. I'll be reopening on January 1st, 2024. Sign up your name and your email address so you can get access first before I share it to the public, so you can start regaining your life without back pain, to have a stronger core and improve overall posture. If you have more time today, I have a lovely glutes and back activation if you have excruciating pain as well. If you're not a back kind of person lying on your back, this is the one, lying in your stomach position, prone position, to decompress your spine. And this lovely video is good to help open your lumbar spine safely and effectively using a bed. Until my next video training, always remember, be safe, be well, and healthy you. Bye.